Welcome to this reader feedback edition of Forthright, beginning with a reading of last week's column. I called it, "You May Fire When Ready, Gridley." It was headlined by the editor as, "Past Time for Inslee to Call End to This Emergency." As published March 3rd, 2022 in the Spokesman-Review. Governor Jay Inslee's recent press conference marked 2 years running the state under an emergency proclamation. He wasn't promoting the anniversary. His big news was moving the end of the mask mandate up to March 12th and a strong condemnation of Russia's invasion of Ukraine. After finishing prepared remarks at press events, Inslee always says, "You may fire when ready, Gridley," introducing question time. It's a reference to Commodore George Dewey's order to his friend, Charles Vernon Gridley, captain of the USS Olympia, to fire the first shots on the Spanish fleet in Manila Bay in what might be described as the U.S. invasion of the Philippines in 1898. The questions are rarely as uncomfortable for the governor as Gridley's torpedoes were deadly for the Spanish fleet. But on Monday, 2 reporters did ask him when he planned to terminate the emergency declaration. A clip from tvw.org of the governor's response would make great video Jeopardy answer. The question would be, what are 3 lame reasons for continuing a state of emergency? In response to the first question from an Everett Herald reporter, Inslee ticked off why he needs to operate the state as a one-man show. First, hospitals need an emergency order so they can continue to require masks. Second, to protect the ability of employees to wear masks if they choose. And third, because it improves our ability to get federal funds instead of using state tax dollars and, quote, "that's why we need to keep this as a tool," end quote. Hospitals have required masks, gowns, gloves, and whatever else is necessary to protect patients, staff, and visitors for decades. Employees have been wearing masks at work without incident in all sorts of settings for occupational safety and personal health reasons. As the mask mandate lifts, it's reasonable to expect Washingtonians to respect each other's personal choices and hospital rules. Half of all states, led by both Democrats and Republicans, terminated their 2020 emergency declarations over the past year. As federal taxpayers, Washingtonians should be embarrassed at being told our governor is keeping the emergency going just so we can game the federal government for more money. When a reporter from KOMO pressed the question, asking, "Why not end the emergency today and let Republicans join you in these decisions?" Inslee used it as an opportunity to fire the opening salvo in the 2022 campaign season. Quote, "Apparently Republicans don't care about employees who want to wear their mask. We respect working people and they don't. I'm standing up for working people," end quote. And then he managed to work in a solid blast at his favorite target, Donald Trump. Another quote, "They just have always wanted to follow Donald Trump," Inslee said. "That's the central problem here. Who first said this was going to be over by Easter? Then he said you can take horse deworming products and has always diminished our ability to and refused to aid the state of Washington when I asked him to help. And the Republicans in this state have followed and continue to follow him and continue to refuse to stand up to his coup attempt," end quote. It seems like a fairly newsworthy exchange. You'd never know the question was even asked if your only source of news is this newspaper, referring to the Spokesman-Review, and that was disappointing. A front-page article below the fold made reference to the new mask mandate rules as part of ongoing coronavirus coverage. A second article on page 6 quoted Inslee's statement supporting Ukraine. According to KOMO reporting, there was a swift response from Senate Minority Leader Senator John Brown, Republican of Centralia, and other Washington Republican leaders. Quote, "The governor clearly seems to believe he has made all the right moves, and he is entitled to that view," Brown told KOMO. "He is less entitled to assign motives to members of the legislative branch who dare to question his decisions and suggest a different path," end quote. Washington Republican Party Chairman Caleb Heimlich told KOMO, quote, "These statements made by Governor Jay Inslee are not only blatantly false, but they help contribute to the political divide in our country. When Governor Inslee talks about unity, he should first practice it himself," end quote. Inslee continues to boast how well Washington State has fared under his leadership because of the decisions he has made, pointing out accurately that, quote, "Our death rate in the state of Washington is one of the lowest in the U.S., and the decisions we have made have been different than other states," end quote. Utah seems a reasonable comparison, with a large metropolitan area and a lot of rural landscape. According to the CDC, Utah's death rate is 131 per 100,000 versus Washington's 149 per 100,000. Utah used a regional shutdown approach versus a statewide and lifted restrictions earlier. Utah's public health emergency order is still in place, but there's no statewide mask mandate. And in spite of strong support from LDS leadership, Utah has a higher rate of vaccine hesitancy than Washington. Governor Inslee might want to cultivate a touch of humility until scientists tease out what is causation and what is merely correlation, and end the state of emergency now. It will be interesting to see if Governor Inslee continues using his quote from Commodore Dewey in Manila Bay at future press conferences. He invited the press to fire when ready, and so I did. This column drew one naysayer and a fair number of positive Attagirl responses. One of the longer positive responses started by saying that he appreciated the article regarding Governor Inslee's braggadocio, and he goes on to recommend a book on leadership, which describes what we would hope to find in a governor, or what Gordon would hope to find in a governor, a level 5 leader who channels their ego away from themselves, who is modest and willful, humble and fearless. And he says he's observed the traits of great leaders that he worked with in both his civilian and military careers. Gordon goes on to say, what I learned from experience is great leaders don't blame others or point fingers for problems they inherit. They just go about solving the issues of the day. In pilot verbiage, when you get in the cockpit, you've got the stick and nobody else. They are humble and don't pat themselves on the back, but rather they reflect all the credit on others. Neither Governor Inslee nor President Biden ever learned this in all their years of working. Thank you, Gordon, for taking the time to provide a reference to sounds like a very interesting book on leadership, and for your comments. It's difficult, I'm sure, to remain humble when all around you are telling you what they think you want to hear. I'm reminded of the story of a high-ranking Pentagon official who gave one of his most junior subordinates a direct order to deliver a report into his inbox at the end of every day with at least one thing he could have done better or a time he screwed up. That was a smart leader, that one. The junior officer was a little hesitant until he realized his senior officer was quite serious about that request for criticism. That story is why I particularly appreciate naysayers who take the time to write, because it always provides for a stimulating conversation when it remains civil. And this exchange with Terry from Spokane certainly was. Terry wrote, your opinion piece today criticizing Inslee is pretty one-sided. Instead of randomly picking Utah stats, why don't we look at Spokane County versus King County? COVID deaths compared to COVID cases are materially higher than the rate as King County. And shockingly, the vaccination rate is materially higher in King County than Spokane County. What could be the conclusion here? And as a matter of fact, I checked as well before I wrote the column. The vaccination rate in Utah is actually lower than the vaccination rate in Spokane County. So it's hard to pin that to vaccination. And that's really the point, is that other states have made different decisions with better results, made the same decisions with different results. And it might behoove Governor Inslee to keep that in mind when boasting. I think the point still stands. Utah's regional approach might have improved Washington's results. It's going to take some time before researchers can shed more light on what really has worked and what's merely a correlation and not a causation. But Terry persisted in this exchange, and he persisted with civility, and that's totally cool, because we need to be able to have those kind of conversations. There's differences in size, and he points out that there's differences in other differences. If you want to argue, Terry says that Inslee should not have maintained the state of emergency for so long, that is fine, but then you should also call out the poor results of Eastern Washington. And that wasn't really the point. There's the numbers at this time are, depending on how you count, depending on how you compare, so many other variables that I don't even want to go there. Again, my point, the theme for this column was that it's time to terminate the state of emergency. And the answer to why he's, and why is he pointing out these repeated claims that he and only he has done everything well? It seems to be the unspoken reason why he must keep control, because saying that the better to consume federal dollars isn't a good reason. And whether hospitals can require masks or whether an employee can say, hey, I want to wear a mask at work, those reasons do not require a state of emergency. I've avoided comparing the data available on death rates as it is published today because there's been minimal attempts yet by science to figure out all the many variables that play into it, from the median age of a population, vaccination rates over a particular area, differences in climate that make a difference in how much time people spend indoors, different obesity rates, rates of other comorbidities. There are very low rates in Africa. Zimbabwe and Zambia are both under 100 per 100,000. I have personal contacts in both countries, and while one might say, oh, they're developing countries and their statistics are no good, they have medical systems that you might be surprised at. They've been dealing with an AIDS epidemic, a viral epidemic, for a much longer time. And it's also surprising there's been minimal impact on the homeless population, although there is a rumor among those on the streets that that's because being on certain illegal drugs makes your body virus resistant. An intriguing rumor, but hardly worth passing out meth and fentanyl just in case. At any rate, Utah at 131 per 100,000 and Washington at 149 per 100,000 as their death rates are both in the West, fairly close together, and you can compare them to other states in the same group like New York, which is at 140, which is inexplicably doing so much better than New Jersey at 370 when they share much the same population and many of the same conditions. All that to say, I picked two Western cherries in the bottom of the list of death rates just to point out that the governor is being prematurely proud. Even the disgraced governor of New York did better if you just look at death rates with no other context. We truly don't know what we don't know yet. And I didn't go there to playing up the numbers because, again, we just don't know what we don't know. Anyway, I do appreciate your giving me the opportunity to share some more of my digging, Terry. There are always many, many more words in my research files than ever see the column page. And for anyone who wants to see what a veteran journalist has to say about the numbers, I would refer you to Jim Camden's column published in the Spokesman-Review on Sunday, March 6th. In this case, the headline says it all: spin control. Whose approach to the pandemic was best? With COVID-19, everyone can have their own favorite numbers. So thank you for listening to this edition of Forthright. Please subscribe on Substack to be notified of future content.